Hi class, this is part 2 of the blood vessels lecture. So we have different circulatory routes, right? We discussed systemic and pulmonary circulation a little bit with the heart. We also have hepatic portal circulation. I'm not going to really get into that here. We'll talk about this. This is like circulation through the liver. We're going to get to this when we go through the digestive system. We'll go through the hepatic portal circulation in a lot more detail. Okay, and then fetal circulation. Okay, we also talked about this a little bit with the heart. Okay, so the two main circulations in the vascular system is the pulmonary circulation, right? That runs from the heart to the lungs and back, and systemic to the rest of the body system, right? So all parts of the body and then back to the heart. Okay, so this whole system starts from the aorta. Okay, and then branches off of the aorta, including the descending aorta. And then blood returns to the heart via veins, right? Arteries take blood away from the heart, veins return blood to the heart. Okay, so going into the heart, right, the main major veins are the superior and inferior vena cava, and then the coronary sinus, which brings blood back from the heart wall itself. Okay, superior vena cava brings blood back from everything above the diaphragm, and inferior vena cava everything below. Okay. And then the venous system of the digestive system drains into that hepatic portal system. Okay, so this perfuses or goes through the liver before returning to the heart. Okay, so here's that pulmonary circulation here, right, from the right atrium to the pulmonary trunk, and then the left and right pulmonary arteries into the lungs to become oxygenated, and then oxygenated blood enters back into the right atrium, right ventricle, and then to the systemic system, right? Now this is oxygenated blood, of course, from the lungs, and that gets sent to the aorta and then out through the rest of the body system. Okay, so this picture here shows, this is in red, so this shows all the major arteries of the body. So just a couple things in general, and then we'll go through each of the arteries in the following slides here. So if you know your anatomical terms, a lot of these are going to be, you should recognize a lot of these, right? So like axillary, for example, right? It's right in the armpit area. Some other things like bones too, right? Left subclavian. Sub means under, clavian, under the clavicle, right? So this is right underneath where the clavicle bone is. Okay. Palmar, digital, right? Those are both anatomical terms from A&P 1. Iliac, right? This is near the hip bones. Okay, femoral, right near the femur bone. Okay, so I just wanted to kind of make you aware of that. These should not be too difficult to remember, the general area where they're found, at least based on the name of the artery or vein. Okay, so I'm going to skip over this slide for now. There's a very similar slide, a few slides forward, where we'll go over the arteries of like the thoracic area and the abdominal pelvic area. Okay, I'm not going to go through this in detail, so you can go back to the heart if you want to look at this. So this is circulation from the heart itself, so that coronary circulation. Okay, so you can take another look at that if you'd like. All right, so we'll start here. Okay, so of the upper limb, and then right and left are going to be basically the same, except left everything instead of right everything that's written here. Okay. Okay. So remember from the heart, the arch of the aorta has 3 major branches off it. The brachiocephalic trunk, this is the one we're going to talk about, that goes into the right limbs. The left subclavian, okay, so this gives rise to the same branches as the right, but on the left arm. Okay, so everything's labeled left instead of right, like I just mentioned. So we're not going to really talk about this. Everything here is the same in the left arm, except it's labeled left, okay? And the left common carotid, which goes up the neck into the head. So we're going to, we'll talk about this, but let's start with the arm, okay? So from the heart, right, from our left ventricle here, right, blood is pumped to the ascending aorta, okay, to the aortic arch, and then through these three major arteries here, okay? Or, and some of the blood goes down to the descending aorta, which we'll talk about when we get to the rest of the systemic artery system, okay? So from the brachiocephalic trunk, because we're going to concentrate on the right side here, okay, we have the right subclavian. The right common carotid comes off of this as well, and that also goes up the right side of the neck, just like the left common carotid goes up the left side of the neck. So we're going to ignore this for now as well, okay? So right subclavian, right, and this is underneath the clavicle bone, okay? Sub, under, clavian, clavicle bone, okay? Then it goes to the right axillary here. So this is in the armpit area. Okay. Then right brachial artery, and then this splits off. Okay. Into the right radial, which is going to be on the thumb side if we're in anatomical position, right where the radius bone is, and the right ulnar, which is going to be on the pinky side, where in anatomical position our ulna bone is. Okay. Then that goes down into the right deep palmar arch. There's also a superficial palmar arch. Okay, so this is more superficial on the palm, and this one's like underneath it, right? It's deeper in the palm area. Okay, there's another branch here, the right common palmar digital. Okay, so these go to the fingers, right? And then right proper. So common always means there are branches coming off. Okay, so it's going to branch off if you see the word common anywhere. Okay, so this branches off into the proper palmar digital arteries. Okay, before that, we also have the right palmar metacarpal artery. So those will be found in the metacarpal area of the hand. Okay, so pretty straightforward and simple there, major arteries of the upper limbs. Okay, these ones here go into the circle of Willis, so let's just go into that next. Okay, so circle of Willis, this is, these are major arteries found that feed the brain, so they're found underneath the brain here. Okay, and we'll talk about what happens if some of these major arteries here are blocked as well. Okay, so let's start up top here at the anterior cerebral artery. Okay, so there's two different segments to this, which is what this is showing, A1, which is down here, and A2 up here. Okay, so anterior cerebral artery. So if we have an ischemia here, and this is a decrease in oxygen supply to the tissue due to some blockage, if the medial portion is affected here, we would, this would affect the primary motor and somatosensory cortex of the brain. So if you remember that from A&P1. So we would have loss of sensation of the contralateral side of the body. So, because remember, the left side of the brain controls the right side of the body, the right side of the brain controls the left side of the body. So depending on what side it was on the occlusion, you would have loss of sensation on the other side of the body. Okay, you would also have contralateral loss of sensation and motor control to the lower body. Okay, um, because this area controls the legs. Okay, um, then we have our middle cerebral artery here and here. Okay, if we were to have an occlusion here, this is the lateral side of the primary motor and somatosensory cortex. So we would have, again, contralateral loss of sensation and motor control, but in this case to the face and upper limbs, okay, not the legs. If it's on the left side, this can also cause Broca's aphasia, which is inability to produce speech. Okay, so very important that these arteries here do not get blocked. Okay, so that's those two here, anterior cerebral and middle cerebral. And then, of course, the same one on this side. One thing I didn't mention here is this little area here. This is the anterior communicating artery between the two. Okay. Here, so this middle cerebral artery, where it branches off over here, this is the internal carotid. Okay, and then branching off of that is the ophthalmic artery there. Okay. All right, then we have the posterior communicating arteries, okay, on the left and right side. So these take blood to the occipital lobe. Okay, so remember, occipital lobe is for vision, right? That's where all of our vision is interpreted. Okay, so if we have an occlusion there, we would lose our temporal visual field and nasal visual field, depending on what side it is on. Okay, we would lose one side of that temporal visual field and one side of that nasal visual field. Okay, so this is known as homonymous hemianopia. Okay, then this long artery, here's the posterior cerebral artery here and here. Then this long one coming down here is the basilar artery. Okay, so if we had an occlusion in the basilar artery, this causes something scary known as locked-in syndrome. Okay, because the corticospinal tracts get damaged in this area of the brain here. Okay, in the pons. So this would cause paralysis, but the person still is alert and conscious. So they cannot move anything except they can still move their eyes vertically, and they're still alert and conscious, but they cannot move at all except move their eyes vertically up and down. So, of course, this is something that you would not want to happen, right? Occlusion of the basilar artery. Okay. Then we have, coming off of here, we have a few things. Superior cerebellar artery, the pontine arteries, all here. Okay, and then we have the anterior inferior cerebellar arteries, and coming off of that, we have our labyrinthine arteries. Okay. So if these anterior inferior cerebellar arteries were to be occluded, this would give lateral pontine syndrome. Okay, this affects cranial nerve 7, the facial nerve, and it causes cranial nerve 7 palsy, so paralysis of the facial muscles. Okay, and this is ipsilateral, so it would happen on the same side of the body. This also could damage the vestibular nuclei in the area, which could cause vertigo with nystagmus, which is uncontrolled eye movements. So your eyes move like very rapidly and you're unable to control them. That's what nystagmus is. This can also affect those labyrinthine arteries coming off of the anterior inferior cerebellar artery. and that would cause deafness. It could cause deafness or tinnitus, which is ringing in the ears, since this is like the auditory artery. Okay. If it affects the middle cerebellar peduncles, this could cause ataxia, okay, which is poor coordination, poor muscle tone, and poor balance. So you lose your balance. The spinothalamic tract is here as well, so where these kind of come off in the brain. Okay. If that was also affected, that would cause contralateral loss of pain and temperature sensations, which can be very dangerous, right? If you don't know you're in pain, that could cause lots of damage without you realizing it, right? Pain is something that's advantageous for us. Okay. Okay, coming down here, we have our vertebral artery, and then coming off of that, the posterior inferior cerebellar artery, and then we have this branching coming down here into the anterior spinal artery. Okay, so we'll talk about the anterior spinal artery here. If we get occlusion here, this could cause medial medullary syndrome. Okay, since it's found on the medulla of the brain here. Okay. And at the medulla, we also have the hypoglossal nerve, nerve 12, right? So this could cause ipsilateral cranial nerve 12 palsy. This could affect, so the hypoglossal nerve innervates the tongue, right? So this could cause random tongue move or issues with tongue movement, issues with swallowing, and issues with pronunciation of words as well. Okay, corticospinal tracts are also here, which could cause contralateral hemiplasia, which leads to paralysis and loss of motor control on the opposite side, the contralateral side of the body. The medial lemniscus is also here, so if this is affected, this would cause contralateral loss of touch pressure and vibration sensations. Okay, and then the posterior inferior cerebellar artery, these ones coming off of here. Okay, so you can see them here. So if that was occluded, this would lead to poor coordination, muscle tone, and changes in balance. This could also affect the vagus nerve, cranial nerve 10, and cause cranial nerve 10 palsy, which leads to dysphagia, which is trouble swallowing, and a negative gag reflex. The sympathetic fibers can also potentially be affected, which would cause what's known as Horner syndrome, which leads to pupil constriction, miosis, okay, known as miosis, anhydrosis, okay, so it means like no water, right? So this means that a person can't sweat, so you can't cool your body down, so you'd get easily overheated in that case. And ptosis of the upper eyelid, which means the eyelid would droop. Okay. So this here is, again, the circle of Willis. So it's found, this is what feeds the brain. Okay, so you could find it underneath the brain right here. Okay, went through arms. This one's just showing here where we have the vertebral arteries. Okay, so it's coming off right over here, kind of off of the subclavian, and then the right internal thoracic, which leads to the mammary area as well. Okay, here's some arteries of the head and neck. So we have our right vertebral here, going up to through the vertebrae to the brain. Our common carotid, okay, that leads into an external and internal carotid artery here. Okay, so a lot of these that like branch off here would be anastomoses. Okay, so if one of them was blocked, the other one would be able to bring blood to specific areas. Okay, this leads up to the right superficial temporal, which is in the temple area, and then branches off into the right maxillary. Okay, so it brings blood to this area here where the maxilla bone is. Okay, so this shows more of that circle of Willis here. Okay, so here are the arteries of the thoracic area and the trunk. So there are lots of arteries shown here, right? So we have large trunk areas, so there's lots of arteries that need to go to specific organs and areas of the body to innervate. So we're not going to talk about every single one here. I'll just touch on some of the major ones. Okay, so here is the thoracic aorta. So we have the descending aorta. Okay, in the first part there, then becomes the thoracic aorta. Okay, and then underneath the diaphragm, it becomes the abdominal aorta. Okay, so thoracic aorta. We have different branchings off here. Again, I'm just going to talk about some of the major ones. Okay, so first the bronchioles. Okay, these will feed the bronchioles of the lungs. Okay, esophageal for the esophagus. Okay, and then the mediastinals here. So this feeds the thymus gland and some areolar connective tissue, and the pericardial arteries here. Okay, this feeds the fibrous pericardium of the heart. Okay, and then we have the posterior intercostals here. Intercostal is for the muscles of the ribs. Okay, so that feeds the muscles of the ribs. And then we have the superior phrenic arteries, and phrenic, if you remember from like nerves, that feeds the diaphragm. So phrenic means the diaphragm. Okay. Once we get into the abdominal aorta here, we have the inferior phrenic, which also feeds the diaphragm, right? Phrenic diaphragm. Okay. Then we have the celiac trunk here, and it has a few things coming off of that. Okay, so we have the left gastric here. Okay, left gastric artery that feeds the stomach. Okay, the splenic artery. So this kind of larger one coming off of that celiac area, that celiac trunk here. That feeds, of course, the spleen, because it's known as the splenic. Okay. And we have the common hepatic artery. Okay, so common hepatic over here. And that's going to feed the liver. Okay. Then going down further, we have this large artery coming off of the trunk here. This is the superior mesenteric, and that feeds into other smaller arteries as well, like the right colic artery, ileocolic artery, and intestinal arteries, and the middle colic artery. Okay. Okay, so superior mesenteric. And then down here we have the inferior mesenteric. Okay, that branches further as well, which we won't really talk about here. And then we have our common iliac here. Okay, and before that we have the renal arteries. So those are going to feed the kidneys. Okay, suprarenal are going to feed the adrenal glands here, and then gonadal are going to feed the testicles or ovaries. Okay, and then the lumbar arteries. And then we have a splitting off here. So this is the common iliac, and it splits into an external and an internal iliac. And we'll talk about that more when we get to when we get to the lower limb. Okay, so here is some of that branching here, okay, of the other arteries. And this is just showing like the splenic artery going to the spleen here, right? Pancreatic arteries going into the pancreas, etc. Okay. Here we have our colic arteries. So let's just go through this quickly. Our right colic is going to feed the ascending colon. So how the colon works, it goes ascending, transverse, descending, sigmoid, because it makes this like S here, and then the rectum. Okay. Ileocolic artery. This here feeds the cecum, which is like the first part here, of the large intestine. Okay, the appendix and the ileum of the small intestine. So this area of the small intestine here. Okay. All right, and then you could see this supramesenteric, that's where those all stem from. Okay. Here we have our superior rectal feeding the rectum. Here, the sigmoids, these feed the sigmoid colon, this area that kind of makes like that S shape. Okay. And that's very important here. So these come from the inferior mesenteric. And here's just a picture where you could see those in an actual abdomen and pelvis. Okay, arteries of the lower limb. Okay, so from the abdominal aorta here, we have our right and left common iliac. Again, we're just going on the right here. Everything on the left is the same though, but labeled left. Okay. Internal iliac, we won't go through, but external iliac, we then lead to the right femoral artery. Okay, and this branches out into a deep femoral artery as well. Then we go behind the knee, it's going to be the right popliteal artery. Okay, behind the tibia is the posterior tibial artery, and then we also go in front of the tibia into the anterior tibial artery. Okay, then right fibular peroneal, so it's going to be on the side of the leg, right? So if we remember again our anatomical terms, a lot of these are kind of easy to remember. Right dorsalis pedis, right arcuate, dorsal, metatarsal, and then dorsal digital. So these are on the dorsal surface of the foot. Okay. This also branches into the dorsalis pedis into the right lateral plantar, right plantar arch, plantar metatarsal, and plantar digital. So this will be on the plantar surface of the foot. So here's the dorsal surface. Plantar is like underneath, like the sole of the foot. Okay. So that's all the branching of the lower limb there. So here you can see them a little bit better. Okay, veins. Okay, so veins of the head and neck. So these drain oxygen poor blood, of course, from the body and then back to the heart. In this case, it'll go back to the superior vena cava. Okay. Okay, so starting here in the sagittal, we have a superior and inferior sagittal sinus. So let's start with the superior. So these take blood from the falx cerebri. Okay, or they're found in the falx cerebri area. Okay. So this goes into like this junction of sinuses. Okay, so we have the transverse sinus, the sigmoid sinus, straight sinus here, right transverse sinus, cavernous sinuses, and these all kind of drain into this sigmoid sinus, into the internal jugular, which is going to now be in the neck area. Okay, we get blood from the vertebral veins as well. Okay, so the right internal jugular and right vertebral drain. These all kind of meet at the subclavian and brachiocephalic, and then into the superior vena cava. Okay, right external jugular as well. Okay, left internal jugular also takes some of this oxygen poor blood, mixes with the left external jugular blood from the left subclavian as well into the left brachiocephalic trunk and into the superior vena cava. Okay, and then here you can see where they're all found within the brain and the neck. Okay, veins of the upper limb. Again, as always, we're just going through the right, but left is the same. Okay, so since this is draining back from the heart, I want to start down here. Okay. So we have the palmar digital veins here. Okay. Those drain into the palmar arch. Okay. We also have our dorsal digital veins on the dorsal side. So palmar side is going to be on the palm side of the hand, dorsal on the back side of the hand, into the dorsal metacarpal and the dorsal venous network or venous arch. Okay. So these here continue to the cephalic and basilic veins. Between those two right here, we have the right median cubital vein. Then the accessory cephalic and basilic again. From our palmar side, we go to the right radial and ulnar. So again, radial will be on the thumb side, ulnar on the pinky side, into the brachial vein. So these all cephalic, basilic, radial, and ulnar are all going to drain into the brachial and then into the axillary, subclavian, down into the superior vena cava. Okay, here's more pictures of those, and of the hand closer up. Okay, so we went through the superior vena cava here. Some other important veins in the trunk area here. We have the ascending lumbar veins and subcostal, so underneath the ribs, right? And those drain into the azygous and hemiazygous veins. And then here we have our veins in the rest of the trunk area here. So we have same thing, our common iliac, external and internal iliac. Those drain upward. So this is all inferior vena cava, where everything drains into to get into the heart from beneath the diaphragm here. Okay. We have our lumbar veins here. Our gonadal veins. Okay, so again, those will go to the testes or ovaries, renal, suprarenal. Renal is for drains the kidneys, suprarenal, the adrenal glands or suprarenal glands. Okay, subcostal underneath the ribs. Okay, and those all drain up. And then we have the hepatic veins. So again, we'll go through the hepatic portal system when we get to digestive system. I don't want to get into it yet. And those all drain into the inferior vena cava. Okay, so here's that hemiazygous vein. We have an inferior phrenic vein, which drains from the diaphragm, right? So if you know what any of these words mean, it shouldn't be too bad. Okay, and here's closer up of that. Okay, so from the lower limbs here. So again, we're going to start at the bottom. So we have dorsal surface and plantar surface of the foot. So let's start at the plantar. So we start with the right plantar digital. Those go to the plantar metatarsal, right? So underneath the metatarsal bones there. Then we have a right deep venous plantar arch. Okay, and then we have a lateral and medial plantar. Those go into the posterior tibial, into the popliteal, femoral, etc. Okay, if we start from the dorsal, so the top of the foot, we get the right dorsal digital, then the right dorsal metatarsal, right dorsal venous arch, and then that drains up into the anterior tibial, okay, small saphenous vein, and right great saphenous vein into the femoral external iliac, common iliac, and then inferior vena cava. More pictures of that. Here we have our hepatic portal circulation again. I'm just going to skip over this for now. Pulmonary circulation is just circulation to the lungs and then back to the heart. So you should remember this from the heart. Okay. Okay, fetal circulation. We'll go through the basics of fetal circulation. Okay, so starting from the placenta, which is an organ that the mother makes, which gives nutrients to the fetus. So this is where the blood is going to become oxygenated. Okay, that leads to the umbilical cord here. Okay, or umbilical. That leads to the umbilical vein, and again, even though this is a vein, this is going to be oxygenated at this point because it gets oxygenated from the placenta. Okay, the fetus doesn't have functioning lungs until after it's born. Okay, so it doesn't get oxygenated in the fetus's lungs. Okay. From there, we have our ductus venosus here in the adult or after the baby's born. This becomes the ligamentum venosum. Okay, so this runs blood from the umbilical vein to the inferior vena cava, then to the right atrium. Okay, then we have our foramen ovale here. Okay, this is the opening between the right and left atrium, and it's known as the fossa ovalis after the baby is born. Between our pulmonary trunk and aorta, we have the ductus arteriosus, okay, known as the ligamentum arteriosum after birth, and this bypasses the pulmonary circuit because, again, we don't need blood to flow through the lungs because it's not getting oxygenated there. Okay. And then the umbilical arteries here. The blood will be oxygen poor, and these will go to the placenta to then oxygenate the blood. Okay, so here's a little flow chart. Don't worry about blood vessel development. Okay, so aging in the cardiovascular system. As we age, the aorta loses some of its compliance, so it doesn't pump as efficiently. We have a reduction in cardiac muscle fiber size, loss of cardiac muscular strength, decline in our maximum heart rate, and increased systolic blood pressure. Okay, and here is showing stages of hypertension. So normal blood pressure should be, systolic should be less than 120 and diastolic less than 80 millimeters mercury. And millimeters mercury is just a way to measure pressure. Pre-hypertension would be 120 to 139 or 80 to 89 diastolic. Stage 1 hypertension, 140 to 159 systolic or 90 to 99 diastolic. And stage 2 hypertension, this would be like an emergency situation, systolic greater than 160 or diastolic greater than 100.